Good morning. If you're just joining us, we're going to get underway in just a few moments. We'll let everyone log in and get into the program. And good morning. If you're just joining us, we'll give it another minute or two and then we will get underway. Appreciate you joining this morning for our COVID-19 vaccine updates and new information that we'll share with you today. All right. Well, thank you everyone for taking the time to join us this morning. My name is Garrett Sheehan. I'm President and CEO of the Greater New Haven Chamber of Commerce. Really glad to have you to talk about this important topic. And we've done several webinars over the course of the last 2 years on COVID, on the vaccine. It's been a little while and a lot has occurred in the last several months. So we thought a good opportunity to come back, talk about where the current situation is, the value that still exists in getting vaccinated, and ways you can protect yourself and the ways that we can still do business given the current situation. As we get started, I do want to thank all of our annual investors who help support the Chamber throughout the course of the year. You can see them streaming across on your screen. We really do appreciate the support we get from all of these organizations and companies that allow us to do what we do here at the Chamber. Also, today's webinar is sponsored by our Healthcare and Life Sciences Council, and that's presented by Harvard Pilgrim Healthcare. And here this morning, to help us welcome our panel is Shannon Duncanson. She is the sales executive with Harvard Pilgrim Healthcare. Shannon, thanks for joining us.
Hi, thank you, Garrett. Harvard Pilgrim Healthcare is happy to be a sponsor of the Healthcare and Life Sciences Council. Here in Connecticut, since 2014, we've been happy to offer employers another healthcare insurance for their employees. As the only not-for-profit health insurance carrier in Connecticut, Harvard Pilgrim Healthcare is proud of its sponsorship with the Greater New Haven Chamber of Commerce and other chambers throughout the state. At Harvard Pilgrim, we continue to look for ways to strengthen our communities in which we live. That's important to us. Through our foundation, we have shown our commitment to our communities by giving over $1 million this past year in grants to local businesses. That's been important, especially as we've made contributions to local food banks to address the needs for our friends and families and our neighbors, which leads us to the topic today. As such, we are very happy to be a sponsor of today's session related to the COVID vaccine updates. So we look forward to hearing from our panels today, and thank you for having us.
Great, thanks Shannon. Appreciate the support from Harvard Pilgrim. And we are ready to start talking with our panel. And we have a great panel this morning, so I'll introduce each of them. Dr. Suzanne Lagarde, she's the Chief Executive Officer for Fairhaven Community Health Center. Also joining us, Dr. Mark Silvestri, Chief Medical Officer and Medical Dental Services at Cornell Scott Hill Health Center. And Dr. Stephen Choi, Associate Dean for Clinical Quality and Vice President and Chief Quality Officer for Yale New Haven Health System. I'm going to let each of our panelists speak for a couple minutes just about their perspectives on what they're seeing with COVID, their perspectives on the vaccine, and then we'll open it up to your questions. So you can start putting those into the chat now. We'll get to as many as we possibly can. So Dr. Lagarde, thank you so much for joining us. And I'll start with you for some of your perspectives of what you're seeing, especially in Fairhaven.
So good morning, and thanks, Garrett, for inviting us. As mentioned, I am the head of Fairhaven Community Healthcare. Just for your listeners who might not know who we are, we're a community health center here in New Haven. We serve close to 32,000 people annually, most of whom are people of color, minorities, and low income. So just briefly, I don't think we can talk about vaccines without talking about the whole spectrum of COVID. And my two co-panelists are much more in the trenches in terms of the medical aspects. So I'm going to talk briefly about our outreach efforts, just to make sure that our listening audience knows what is out there and what is available. So I like alliterative things. So I have the 3 T's, right? The 3 T's are testing. The second T is building tolerance, which is vaccines. And the third T is our therapeutics. And we now have certainly decent therapeutics for the treatment of COVID. So on the testing front, we've been testing since literally the onset of the pandemic. We continue to test here in Fairhaven at our 350 Grand Avenue location. It's walk up Monday to Friday, 9 to 1, no charge. Anyone can come, any of your listeners, your employees absolutely can just show up and we will test you. Just to give you some perspective, to date, we've performed over 85,000 tests since the pandemic started. Nowadays, testing also includes the rapid antigen, the home test, and we're fortunate to have a really robust supply of these test kits given to us by the federal government. So we're very busy giving these out. So we're collaborating with our schools in Fairhaven. We're collaborating with our businesses along Grand Avenue, the public library, et cetera, to get the rapid test kits out into the hands of our residents. Moving on to building tolerance or vaccines, obviously that is critically important. And we were just talking before this webinar started about the challenge, particularly in the 5 to 11 age group. So we're doing our best to try to reach out to that population. Right now we we vaccinate at our 374 Grand Avenue site Monday through Friday, 8 to 5, Monday, Wednesday, and Friday. We go to 7 p.m. Tuesday and Thursday. We're also doing kids, including walk-ups at our 150 Sergeant Drive site Monday and Wednesday, 3:30 to 7, and every other Saturday. And to date, we've administered over 30,000 doses of vaccine. Critically important part. And last but not least, therapeutics. We have the ability to prescribe Paxlovid, which is the newest oral agent manufactured by Pfizer. We're fortunate to have a supply of those. So for people meeting certain criteria, as long as we can diagnose them early within the first 5 days, this is oral treatment. If somebody's deemed to be high risk and eligible, we can treat them. And again, it doesn't have to be our patient. So if somebody knows about somebody and really wants to, get treatment for them and they're running into issues, we should be considered a resource for that. Last but not least, I want to address the issue of safety, which all of these things have to be administered through the lens of safety. As a healthcare provider, we do feel strongly that it's important that our staff as well as our patients be vaccinated. So we do have a mandatory vaccine policy for our employees, and that includes now boosters, which we just recently implemented. We continue on our clinical floors to mandate masking, social distancing, et cetera. I'm hopeful that things are looking better and all of this is going to improve very quickly, but that's sort of a snapshot of where we are today, Garrett, and I'll turn it back to you.
Great. Thank you, Dr. Lagarde. Appreciate it. Let me turn now to Dr. Silvestri for your perspective from Cornell Scott Hill Health Center.
Sure. Thank you, Garrett, for the invitation, and thanks, Shannon, for sponsoring this. And thank you, Sue, for ending on the hopeful note. I mean, that's certainly, I think, where we all are. I think there have been a number of moments in this pandemic when we've been hopeful, but I certainly think there are various reasons to, at this point, be hopeful. Just to give a word of background, so I'm the Chief Medical Officer of Cornell Scott Hill Health Center, which is a community health center here in New Haven. We also serve Hamden and Sonia, the West Haven area, and care for about 50,000 patients. We, just to go into maybe a little bit more depth in some of their areas that Dr. Lagarde was talking about, it's obviously been a rough past month with the Omicron surge, and I think it's been challenging for the healthcare community on the inpatient side, on the outpatient side, and I'm sure it's been challenging for businesses also. The good news in that regard is that our cases in Connecticut are down to about where they were in early December. I think there's some other pieces of good news, which is there continues to be new and increasing information about the effectiveness of vaccines and now booster doses in reducing the likelihood of hospitalization and death from COVID. The most recent large chunk of data from the CDC from right before the new year basically showed that for those individuals who've gotten both doses of a vaccine, they have about a 1/10 risk of death from COVID from those who haven't been vaccinated. And for those who've gotten a booster shot, they have almost 1/10 of the risk of those who've been vaccinated. It's almost 100-fold reduced risk of death from COVID. And I mean, if you told me I could get a shot that would reduce my risk of dying from a heart attack by 100-fold, I mean, I would say sign me up. So I think it's really important that the enormity of the effectiveness of the vaccines is something we continue to talk about, because it really is going to be something that enables us to be able to continue to live and function and work in the world that we're in right now. I would also, just to piggyback on what Dr. Lagarde was saying, the availability of therapeutics is another huge reason for hope. And initially they were in short supply, but the criteria for who's eligible for the therapeutics has been able to broaden a little bit with the declining number of cases and with the increased availability of some of them. So I think that's going to be another crucial piece in our armamentarium going forward. So I'll leave it there and look forward to questions.
Great, thanks, Dr. Silvestri. And Dr. Choi.
Hi, good morning, Garrett. Thanks for having me back here. I think I would just echo what my colleague said here. It's been a long 2 years. We're about to hit our 2-year anniversary in just a few weeks from the start of the pandemic here in Connecticut. But I think anyone who's watched the news or turned on the radio are probably relieved to see that we seem to have been pretty consistently out of the peak for this most recent fourth surge with Omicron. I think we peaked in the state about a couple weeks ago. I serve as a chief quality officer at Yale New Haven Health System and the med school, and we probably have taken care of close to 20,000 COVID patients in the hospital. And we're seeing that number drop pretty consistently. But, as Suzanne and Mark said, I think there's a lot of cautious optimism. And I say cautious because, we can't predict if and when a new emerging variant will come out that may, circulate through the globe. And I'm sure there are people who are going to ask about the Omicron BA2. I'm going to specifically not refer to it as stealth because I don't think that's a good moniker for a new subvariant. But I think it's fantastic that we have vaccines, something that we did not have, certainly not available to the entire general population a year ago. And now we just got recent news that Pfizer has submitted for their EUA through the FDA this past week. And we're hoping that submission for the 6-month to 5-year-old patient population will be expedited, much like the 5 to 12-year-old submission through the FDA, and then obviously would go through the CDC for endorsement. So we're hoping that within a short number of weeks that all children above 6 months will have access to the vaccine. We know with a high degree of certainty, and I want to repeat that because I keep getting asked this question about whether the vaccines are safe for children. It absolutely is. The CDC recently released a publication on close to about 7,000 patients who had COVID and then developed what we call MIS-C, that's the multi-system inflammatory syndrome following COVID. And for those kids who got it, nearly 100% avoided it if they were vaccinated, which I think speaks volumes. And I think for those parents who are hesitating to vaccinate their kids, I would say you got to take that statistic very seriously. We do have children that are hospitalized, with children that are in the ICU. And that study also quoted that 100% of children who were admitted with COVID that required life support. Those are the patients in the ICU on ventilators. 100% of those kids were not vaccinated. So that's more reason to get your children vaccinated as well as yourself. And as Suzanne mentioned, we have got great therapeutics that are available, both oral therapeutics through Pfizer, and we've got great, monoclonal antibodies that seem to be very effective in avoiding severe disease, particularly for that vulnerable population. So I think the optimism is well-founded, Garrett, and I think some of it is just exhaustion, but I think there's good scientific merit to think that we're going to slowly transition to an endemic phase with COVID. So I'll stop there.
Yeah, thank you. We've gone for almost 2 years now, and COVID changes so much. I think that's created a lot of challenges with messaging to the public as to what they need to do, where they are, and it's just because of the changing nature of COVID and because of the length of time. And I think back to we had flattened the curve. Then there was a point in time where we thought the vaccines really would almost stop most COVID from getting. All of these things have changed. I guess how can we reset people to where we are right now and how they should be going about their daily lives, given what Omicron has changed our understanding of COVID and what we think about vaccines. But I guess how that applies to how they operate in their personal life and in their business. Anyone want to jump on that?
I'm happy to answer that. I mean,
Go
I
ahead.
guess I'd answer, as I, answered to my colleagues and friends, which is take your risks very carefully and practice the same things that we asked you to practice, in March 2020, which is, currently I would mask indoors as often as possible. I'd spend as much time as you can, weather permitting, outside, and I would avoid crowded gatherings. And that's a position we've taken for our hospital employees, both while at work, and that's what we endorse when they're out and about in their personal lives. I think, again, I'd iterate for vaccines, and just to be clear, the efficacy of the vaccine has been tremendously improved with the booster. And now, if you're 12 and above, you should be getting your booster dose. So, I think that's some of the misconception that the vaccines and the boosters are not effective, but it's been shown clearly that the booster efficacy really brings up your protection against Omicron to 80-90%, and then much higher, closer to 95 to 100%. Protective against severe disease requiring you to be hospitalized and all the horrible things that can happen if you get worse in the hospital.
Sue or Mark, anything you want to add there? I mean, I definitely have heard, I think a refrain with people is, everyone's going to get Omicron. I don't know that that's necessarily true. And how do you address people's kind of perceptions of to deal with the current situation?
So I'll jump in briefly, Garrett, and just say that what I advise people when I'm asked this question is you have to sort of determine your own barometer for risk, right? I think there are different people who have different levels. Older people in general are, because of all of the appropriate bad press about what happens in that population, tend to be a lot more cautious. I think if the substrate is that people are vaccinated and they're willing to take some small amount of risk and go out and have a meal and enjoy the evening out, I think it's an individual parameter as long as the person is making it an informed decision.
Thanks, Sue. And Mark, anything you want to add there?
I mean, I think there is some degree of truth to the fact that everybody will get COVID at some point. I think we sort of come to accept this. If we look 5 years from now, probably everybody will have had it. Some people won't have known it, just like some people have had it and haven't known it. I think the question is really, how sick do they get from it? And as Steve was mentioning, the goal is to avoid severe illness from COVID, being hospitalized, and the other dangerous things that can happen to you with complicated COVID. So the best way to avoid that risk is by getting vaccinated and boosted and following the CDC's recommended vaccine schedule for it, which will probably continue to evolve as we move into an endemic phase. But we're still at the point where everybody's gonna make their own individual risk assessment, and I think that's where we are at the moment. There are certain activities that may be of higher value, but the risk of being in a crowded group of people who aren't wearing masks at a time when we're in the middle of a COVID surge is going to be high, and that might be something that isn't worth the risk at that point in time.
Great, thanks for those answers. We had a question, and I know Sue answered it in the chat, but I'll just bring it out more widely. There was a lot of, we pushed out a lot of home test kits. And so while we've seen the numbers decline, should anyone, what should we think of that people are testing at home and those numbers aren't getting collected in the overall total? Or would we likely be seeing an equal decline in negative home tests, or excuse me, positive home tests?
Yeah, so home tests are fantastic, and the only word of caution that I would use is that the specificity and the sensitivity, so the rates of false positives and false negatives really are not on par with each other. So what that means is if you take one of those rapid antigen tests at home and it's positive, you're positive. I think there's this misconception in the community that, well, if I test positive with the home rapid kit, then I should go to another testing center and get a PCR test. We discourage that. In fact, we consider a positive rapid test a positive test. With a negative test, because the sensitivities aren't as great, you're talking about anywhere from a 20 to 40% chance that that's a false negative, but it's better than nothing. So we encourage people to home test at any given point when they are symptomatic. Some people like to home test because they've been exposed, but remember, you can't test positive within a day or two. It's really unusual. You're gonna have to wait a couple of days at least before you build up enough of a viral load to test positive. But we have no mechanism to manage the results and to really, confirm a adequate chain of custody when someone reports a home test. So we don't report that in our state numbers. So yes, are the numbers somewhat underestimated? Probably, but it's really the overall trends that we're looking at, and the trends in the last couple of weeks have been very, very favorable.
So I don't know if there was something you wanted to add there, but it also asks the question, should everyone, is this part of the way we should operate now of having home tests? I know the federal government, you can get those, you can get up to 4 per household for free. So Sue, is that the way people should approach whatever's next with COVID?
So I'm a profound proponent of home testing. I really believe that this is one of our ways of keeping ourselves safe. The problem is that even though we're all getting these test kits, it's not enough. I mean, for 2 years, we've been saying we needed more test kits. And I do think as a country, we fell really short on that one. And although the flow is, we're not where we were in December when, people were fighting in the aisles at CVS to buy a test kit, the flow is better. Truly, the way it would be done, and if you wanted to keep everybody safe, is that we would test often, because we know many people are completely asymptomatic. I just learned that there in New Haven, at least, there is a program now starting in the schools where they're going to be doing PCR tests on kids once a week, obviously with parental consent. I think that's phenomenal. I would love to see that extended to staff as well. And I would even love to see it extended to twice a week. But, testing is really the way to, when I talked earlier about your own sense of how much risk you're willing to take, if you can test and the people around you can test, your risk really falls significantly. And of course, assuming you're fully vaccinated.
And I just want to echo something that Steve said too about a PCR test not being needed after a positive home test. It's something that we've seen at our testing sites that really sort of can create backlogs and increase the wait times and diminish the access for testing is when folks who've already had a positive home test come for a PCR test. So we would discourage that. And furthermore, you don't need a negative PCR test to be cleared in any way from COVID or to return to work. So we would certainly encourage businesses in the area not to ask employees to get a negative PCR test after a positive home COVID test, because we actually know that the PCR test can pick up pieces of the viral DNA that aren't even that don't even represent functional transmissible virus for weeks beyond someone actually being infected. So.
And Mark, let me build on that because lots of confusion last month and a little bit into this month of when can people go back to work, go back to their activities if they did test positive for COVID. So I know the CDC put out the 5-day guidance, that wasn't fully adopted by everyone. How do you view it, and how should employers feel about when their employee says, hey, I'm ready to come back to the office?
So the first thing that I would emphasize is strict mask use for 10 days. I mean, that's, the strict mask use and the other piece we should add is ideally a medical mask. It's become more and more evident that a medical grade mask is superior in preventing transmission compared to some of the cloth masks. So, medical mask use for 10 days. Now, it's consistent with CDC guidelines for individuals to come back to work after 5 days, day one being the day after symptoms started or the positive test. If there are situations where an employee can stay home for longer, can work from home, then I think that'd be very reasonable at a minimum 7 days and maybe even 10 days, depending on how disruptive it is to have the employee working from home. But the risk of transmission is certainly significantly reduced after the 5 days, and especially if they're wearing a well-fitting medical grade mask at all times.
Great, thank you. And talking about those masks, and Dr. Choi, maybe I'll go to you with this one. So we have heard the guidance has changed. N95s are the best. The KN95s work as well. If someone's still wearing a cloth mask, is that essentially like you're not wearing a mask at all, or is it still providing some level of protection? Or
sure, no, any mask is better than no mask. I think there was one study, I think it was out of Duke, where they showed that those ski gaiters may have been worse, but I don't think that's been supported yet since that study. But certainly those paper surgical masks that are 3-ply really offer the best protection. And if you can get access to KN95 or N95, absolutely. But we know in the community, not everyone has that privilege or that advantage point where they can purchase those masks. They do tend to be expensive. So, as much as possible, we say, wear those paper surgical masks, and if you get a KN95 or N95, that would be better.
thanks. Sue, let me ask you a question in regards to vaccines. We know there's a lot of people who have decided that they don't want to get the vaccine. How should people who are vaccinated feel about their own health and safety level when they're around them, especially as more people go back to the office? The federal courts had struck down the blanket vaccine mandate. So in those kind of mixed work situations, personal situations, should people feel concerned, or is it more about the individual who's not vaccinated that's at risk?
I think it's both. There's no question that we know that those who are unvaccinated can have virus, even though they're not symptomatic or are minimally symptomatic. So it's really important that we continue in the workplace to try to keep social distancing, wear masks when amongst other people, except when eating, etc. So it's not solely their own risk. It is certainly the risk of those around them. I'll leave it at that.
And so just to be clear, so it's because they're going to have a higher chance of having COVID because they're not vaccinated, which is what gives the greater risk for everyone else.
Higher chance of having COVID, higher what we call viremia, a higher level of virus in their body. And again, we know that even then they can be asymptomatic, or they can have symptoms that may be just attributed to colds or allergies, which it turns out that it's really not the case, and it's COVID. So it is an issue, to be sure. I think to not acknowledge that would be a mistake.
Let me ask, and anyone can jump in on this, just on boosters. How are we doing generally on the vaccinated population switching to get that booster shot, and kind of what are the future of boosters as you see them? Maybe Mark, I'll start with you and then go around.
Sure. So I think the uptake of boosters, there was, sort of consistent with each wave of vaccines becoming available. There was large interest at first from those who were waiting with bated breath for the booster to become available. And then there's sort of a long, slow tail of people who are sort of coming around to realize that it's probably worth getting a booster shot. I think, when Connecticut last released statewide data, across the state, it was only about a third of the population that actually received booster shots. So that, from I think I can speak for all of us, is disappointing because certainly, getting the complete initial series and then getting a booster is going to be the best way for us to minimize the impact of COVID on families, schools, businesses. So we do, though, I mean, the encouraging part is we certainly continue to see, like I said, an ongoing trickle. We're still giving about 1,000 vaccines a week, from individuals who are deciding, okay, you know what, it's time. There's starting, I think, to become increased acceptance of, even though I had COVID before, I should still get a booster, which is the recommendation. Even if you've had COVID a month ago, you should get boosted. You can get boosted actually as soon as you're out of your isolation period in order to provide protection against subsequent infections. So we would certainly encourage businesses to do whatever they can to encourage their staff to get the booster shot and to talk about the safety and the efficacy of it.
Dr. Choi, your thoughts on boosters and getting more people in to get those?
Get them. And that's really it. I mean, the data supports that the booster really returns that efficacy, particularly against Omicron. And it does look like you're going to get the same protection with BA2 against the BA2 variant, subvariant that we're seeing over in the UK, at least the prelim studies. But again, with the booster, whether you've had your two-dose mRNA series or a single dose J&J vaccine and then the booster, your protection against Omicron, the current prevalent variant right now is 80-90%, and then even higher in terms of having mild disease or offering you the protection so that you only have mild disease and not ending up in the hospital. So absolutely, I emphatically encourage everyone to get a booster. And when people ask me, should I get it, I always respond, what have you been waiting for? You should absolutely get it.
Dr. Choi, maybe I'll stay with you for this next question. And Mark started to bring it up. Natural immunity from having COVID. I've definitely heard folks who have been hesitant to getting the vaccine saying, well, I already had COVID, so I don't feel like I need to go get that. Can you just explain, natural immunity from COVID, I've read, does have an impact on your chances of getting COVID in the future, but how does that interact with the vaccine and what does it change for your chances?
Sure. So I think most people on this panel or on this call have probably heard the term neutralizing antibodies. And those are the antibodies that both the infection or recovering from an infection offers you for some protection, and then antibodies, the same type of antibodies you build after a vaccine. And when they've studied those two populations, the level or the titers, we call them, of antibodies that protect you against COVID are significantly higher after the vaccine versus recovering from a COVID illness. Furthermore, the longevity of protection is much longer with the vaccine than with COVID. We now have hundreds of thousands of people who've now gotten COVID more than once around the globe, and some people have gotten it 3 times. But we do know that getting a active infection will give you some protection for 3 months, but really not the kind of protection we're getting with vaccines. It's much longer, and again, the level of protection is much higher with the vaccine.
And Sue, are you seeing that people? I read that people who had just had Delta, that was not any protection against getting Omicron over the last several months. Is that what you guys were seeing in Fairhaven?
Absolutely. Yep.
Oh yeah, and Sue too. Yeah.
Oh, I'm sorry. Yeah, there's no question. And Omicron almost seemed like a different beast, right? With its profoundly contagious in nature, the fact that it didn't respond to the standard monoclonal antibodies that we had, the fact that it's somewhat milder disease in many cases, but certainly not in all. It's a lesson that the variants of this disease are going to all have their sort of own personality. I do want to go back to the issue of the booster. One of the things we hear a lot was, for those people who got the first 2 shots and may have been a bit on the fence, now they want a booster. The response I'm hearing sometimes is, see, I told you it was, why do we have to have a booster? If this drug is so great, why do I need a booster, right? I just would like the listeners here to realize that you haven't heard the end of boosters. I guarantee you there will be more boosters coming down the road. And in many ways, this is not very different to what we've been used to for years with flu vaccines, right? Every year you can think of the flu vaccine almost as a booster. And that's because every year there's a different set of variants of influenza that are coming around. And so the vaccines are made, you know, targeted to those particular viral agents. Same is going to be true for COVID. So this is not the end of boosters, and it by no means indicates that the vaccines are ineffective. It just means that these viruses are incredibly effective at mutating, and until we get a very high level of herd immunity, we're going to continue to see this.
Dr. Lagarde, I'll stay with you for this question as we talk about boosters, but also even just first vaccinations. What are the population groups that you're seeing that haven't gotten the vaccine even to begin with? I know we were talking about children before as being in a big area. And what are the types of methods you're using to be able to reach these groups, reach parents, reach different adult populations that have chosen to this point not to get it?
So I do want to emphasize the children because it is a real concern. So the statistics in New Haven, the last time I looked at them, which was like last week, was that of eligible kids in the 5 to 11 age group, 17% were fully vaccinated. I mean, that's a scary number to me. And and it's not only for those children's protection, as we've said repeatedly, it's for everyone's protection. We've said this from the very beginning. We're all in this together. If we're not all safe, no one's safe. And that could not be more true. So I'm concerned about that for sure. I think we all have you know, we've all seen the folks who are just really die hard. They're not going to get vaccinated no matter what. We certainly continue to try to make the vaccine availability as easy as possible, going out to what we call pop-up clinics, going to various food pantries, churches. I do personally believe that some of our best messaging people are our clergy, our people of faith, because they're the ones who can really, I think, have the trust of people, because at the end of the day, this is essentially about trust, and trust that what somebody is telling you is true. And I do believe that using the clergy to the extent possible is one of our best weapons in facing this problem, which is huge. I mean, there's some people, you know, we read about it all the time. People, anti-vaxxers, right? And they die of this disease. It's incredibly tragic.
Mark, same question. I know Cornell Scott Hill is mobile van and gone to a lot of different places. So what are some of the strategies you're using to reach out to other populations?
Yeah, absolutely. We're continuing to do that. And you know, to your question about children, I'm sure that our colleagues at Fairhaven and Yale are doing the same thing, but we operate clinics at a number of schools throughout New Haven and the surrounding towns. And so to Sue's point about trust, you know, that's a place where we have an established trust relationship with the parents and families there. So we are doing outreach to the families of the children in the schools to encourage vaccination. That really is right now the biggest area that we need to improve on is the children. And I understand it's interesting, you know, I think that, you know, usually the reason that people are hesitant to get the vaccine is some perceived sense of risk. And so I think that they're more sensitive to that perceived sense of risk, maybe with their own children than with themselves. But I mean, as Steve was saying earlier, we really have to give voice to the risk of not being vaccinated, even for children, and the type of severe illness that can happen when they get COVID. So we're doing the best we can, you know, but it's going to take everybody in every way, big and small, trying to continue the messaging that this is a really critical intervention.
Dr. Choi, I know we were talking. This is one of those complicated conversations had with vaccinated parents who have chosen not to vaccinate their kids to this point.
Yeah. I think there's a couple themes here that are at play. You know, one, clear, I mean, without a doubt, Omicron is less invasive, and it's certainly a much milder disease than the Delta variant. But as Suzanne mentioned, it's so transmissible. So the sheer number of people who've gotten it, and then within that group, they're the small percentages of children, healthy children too, who do get sick enough to end up in the hospital. And so what the public doesn't see is the sickest of those patients. And at Yale New Haven Hospital alone, at our children's hospital, we had a record high of close to 150 children admitted with COVID in the month of January, and many of those children were healthy kids, but were essentially all unvaccinated. The ones who were vaccinated that got ill enough to be admitted, they often had other diseases that were exacerbated with COVID, which is what we've sort of seen with Omicron. It's been a shift in terms of, what is the primary insult. But I think what parents need to know is that, not every child is going to be that lucky to get by with just a few days of stuffy nose or a cough or sneezing. So again, absolutely have to get your kids vaccinated for sure.
We're going to wrap up in just a moment. So if anyone has any more questions, please put them in the chat. Let me just ask one question, maybe Dr. Choi, you can answer this. We do hear a lot in the news of, it's generally Omicron has not been dangerous unless for people with underlying conditions or certain groups. But can you, and anyone else who wants to jump in too, just talk about what are underlying conditions? Are there people who have underlying conditions, they don't realize they have underlying conditions? And is that, something that just people should be aware of and not just pass that off as that's someone else?
Yeah. So yes, the most vulnerable patients with immunocompromised states. So people who have cancer or have other immunological diseases, such as rheumatic diseases that require anti-inflammatory or immunomodulating therapies that can impact their ability to fight infection, or certainly at risk. People with significant cardiac disease, people with significant pulmonary disease, renal disease, and so forth. Those clearly are the most vulnerable patients. But what the public is not appreciating, because they probably don't see enough of this, is that anywhere from 10 to 30% of people who recover from COVID have what we call long COVID or long-term COVID symptoms. And those could be really debilitating. And we've got patients at Yale that we follow in this clinic who still, after almost 2 years, are still suffering from cognitive or memory loss or brain fog for lay folks, people who've got significant fatigue, people who can't exercise. We have many adolescents who are on college scholarships, who developed COVID, who've actually lost scholarships because they just simply can't participate in their respective sports that where they were once very, very competitive athletes. And then we have folks who've got long-term cardiac disease, pulmonary disease, and renal disease. So the numbers really don't tell the full story in terms of survival, because even if you survive, there is that chance that you will then suffer from long-term COVID complications. And I think that is, oftentimes even scarier for patients or for the population to understand. And I think that's something we probably haven't done a good enough job in terms of marketing, discussing, and talking about the benefits of vaccine.
As we come to the close here, I'm going to give everyone a chance just for a final thought, and in particular, kind of how we continue to operate, move forward, living with COVID, a term we've heard a lot. And I should just say, as a chamber, we put this on today because we wanted to reset. We think things have, there's lots of different information out there. So it's good to have clear thoughts from our panelists. And we're always advocating for getting business activity going back on, but just having people informed about what the risks are and how they can manage those themselves. So Mark, with that, maybe I'll have you start off, and then I'll go to Dr. Choi, and we'll finish off with Sue.
Sure. I mean, I think we're probably going to be coming to a bit of a reckoning with the fact that we're living with COVID, and that it is going to become an endemic illness that that we have to balance with all the other risks we take in life. And it's tricky on the medical side. We deal with the we feel it quite difficultly when there's a big surge and we have to take care of an increased number of sick patients. But right now, the risk for a fully vaccinated, fully boosted individual of dying from COVID is actually similar to some of the other risks that we face in regular daily life. So I think where we're going to have to move is creating strong incentives, or maybe I should say disincentives to not being vaccinated, so that we can move to a point where the risks that we face from COVID are similar to those that we would face from driving on the highway or interacting with others and potentially getting influenza or things like that. So it's not to minimize it, but it's to say we're going to have to all in our collective consciousness figure out what are the reasonable things we can do to reduce our risk as much as possible, and then figure out how to balance that. So I think that's what I would say, and I think that in my mind that's where there's a little bit of optimism here of potentially being able to maybe over the course of this year start to strike that balance.
Thanks, Mark. Appreciate you joining us. Dr. Choi, your thoughts on it, on how we strike that balance?
Oh, well, that's a tough question. I think, again, I would, annotate that we have cautious optimism that this will transition in the near future to an endemic. But what that means is, unlike, SARS-CoV-1, this will not go away. We'll be living with it with some high degree of certainty that it'll be a permanent within our globe, but that it will be a much more tolerable disease in terms of the sheer numbers of people who are immune to it, both with the vaccine as well as with active infection and who've developed some tolerance to it. And we do think over time, just as many of the other respiratory illnesses, it'll predominantly be something that we just have to deal with seasonally. But, we just don't know what the variants will evolve into in the upcoming months and years. But I do think for this current calendar year, we're looking in the next few weeks to return to some of that lower prevalence rate that we enjoyed over the summer. But afterwards, I think it's a little too hard to predict for now.
And Dr. Lagarde, I'll let you close this out. And I'll just say too, I know we have also seen a lot of negative impacts that people have gone through because of all the things we've had to do during COVID. And you talked earlier about that risk tolerance level that people are going to have.
So I think it's fair to say we have all been humbled by the past 2 years in terms of our vulnerability to things beyond our control. And I think I have tremendous optimism. I do think for the audience, who I'm assuming are employers, I would urge you to think amongst the benefits, right? As employers, we think about what benefits can we give our employees. I think one of the benefits that you can give them is working positively, gently, but be committed to the fact that convinced that the goal at the end of this effort is to convince people that vaccines are what is important. Make it as easy for them as possible. If they needed some time off to go and get vaccinated, encourage it. I do think that going forward, testing and masks will be an important part of our day-to-day activities, and will, I think, enable many people to feel safer. So this question of what your risk tolerance is will be much better if we, knowing that you have testing readily available, masks readily available, and I do think that the next big wave, and I'm sure that's what is on the mind of all of your listeners, is the economic impact that we all already are seeing, right? We're seeing that amongst our patients every day, and that's going to be our next big. Well, it's upon us. That is our current challenge, and it will be our challenge for a while. But that sounds like a downer. I want to end on a positive note. I do think we are in a pretty good position compared to where we've been for the past 2 years. I'm optimistic, and I'll leave it on that note. Thank you.
Great. Thank you, Dr. Lagarde. And I did hear from all three of you the word optimism. And so that's great to hear. And also, not only want to thank you for being on the panel, but thank you for all of your personal efforts and your teams, your staff, your organizations, for all you've been through and done over the last 2 years. I know through different points of intensity, just really helping our business community, helping our entire society make it through this. So thank you so much.
Thank you for having us.
Thank you.
Thank you, Garrett.
Anytime. As we close out here, I'll just mention we do have our internship career and job fair coming up on February 17th. We're going to be in person at Long Wharf, but we also have a virtual component if you want to participate through that. We have actually all of our in-person booths have sold out, but we do have virtual booths that you can purchase. So you can go on to our chamber website to register. We'll be wearing masks. We'll be doing a bunch of things to be able to keep people safe there, but excited to be able to connect people with jobs and careers. So again, thank you to our panel. Thank you to everyone for joining us, the Healthcare and Life Science Council and Harvard Pilgrim for their support, and hope everyone has a great day.